Hi, everybody. Welcome to tonight's Sunday night, the winter program over here with Coach Menachem Bernfeld. Thanks for joining us from around the globe. Tonight, Shir 174. Yep, you heard that right. 174. And Baruch Hashem, I will start thanking all the people that help us, let us know about the program, the advertising sponsors, and just the people that posted, let people know about it. Just to clarify, we used to send everybody a WhatsApp flyer personally. Now we're doing it only on the groups. Menachem, I'll be post the group link in the chat shortly, and in the emails there'll be a link as well to join the group chats. If you want to join the group chats, you could also WhatsApp me at 732-314-1710, and I will give you the link to join the chats. That's where all the flyers are, the replays, all the information. So please join us. And again, thank you for making Coach Menachem program the people's program, a place we could have Sichas Chaverim, talk through things, and join. And Menachem, we're going to be putting up this video later tonight. Menachem will upload it to YouTube. You can click on the subscribe button. So every week when Menachem uploads it, you get a ding. You know that there's a new program. You get to watch it. And you can click on the like button. And thank you again for joining us here tonight. First, thank you to all the advertising sponsors, the Lakewood Scoop here in Lakewood. A special thank you to Eli Nario for Five Town Central and Chayla Kaufman from JCN for always supporting us on all the Jewish digital networks. Again, for the first time anybody has been here, every Sunday night at 9:30 on this Zoom ID, we have different topics, different rabbanim, different therapists, and just the leaders in Klal Yisrael that really have a lot to share with people and give people chizuk. And please join us. Next week, February 11th, we're going to have an amazing program with Rabbi Shais Tab, who's one of my favorites, who comes on all the time. The last time he came on, we had a very powerful program. We had a tremendous amount of feedback. He was talking about what men need and male masculinity. And, it was very powerful. A lot of people reached out to me, men and women, just saying how he validated and really just, really clarified that inyan. So we're going to flip it around this upcoming week. We're going to talk about femininity, what women need. And the title is What is a Woman? A Spiritual View of Femininity and the Challenges of Jewish Women Today. So I think it should be a very amazing program. And Rabbi Shais is deep and he gets into it, and hopefully it'll be chizuk and everybody could really be part of it. Tonight we have the schus and the honor of having world famous author, a psychologist. He writes in the Mishpacha. Everybody wants to know he writes, he doesn't write. I don't know where he's holding with writing in the Mishpacha. He's been so busy. He wrote 2 books, Off the Couch and Things I Told My Parents. There's also a children's book, and hopefully get some guidance. And we actually have 3 topics tonight, and we're going to try to really cover as much as we could, at least at the first topic about what's good in therapy, what's not good in therapy, which is the main topic, and we'll get into that soon. Menachem tonight, hopefully share should be mechazik thousands of people that watch it now, and hopefully later of the replays. Tonight's share is 174, and our friend Unveiling is going to give us an amazing gematria for the share 174, who every week with constant continuity never misses a gematria. So Unveiling, give us a gematria for 174.
Shir number 174, we're going to be discussing Unveiling Wellness, a comprehensive talk on mental health, what to avoid in therapy, the extreme conflict in Israel, and strategies to combat burnout in today's fast-paced world. Whatever hardships we may incur, we must realize that Hashem does only good and means only good, which leads us up for tonight's Gematria 174, Melech Toiv Umetiv, the king that does good and only good for each and every person.
And we really appreciate that. And now we're going to turn to Coach Menachem Bernfeld. We're trying to really chop around because everybody should know that Dr. Freedman leaves at a certain time because he's in Israel. It's now 4:30 in the morning. So we're going to try to really speak very high fast. And this is not 1x, this is 3x. No, I'm talking very fast. So I want to get to Dr. Jacob Freedman. Coach Menachem, open it up. What are we doing here tonight? What are we trying to accomplish? And what's really the topic? What are we trying to get into?
Okay, thank you very much. Welcome everyone to another Let's Get Real with Coach Menachem and Baruch Hashem with a lot of Siyata D'Shmaya, number 174, like we heard. And it's exciting to have you back, Dr. Freedman, to have a discussion on mental health, which this is your passion, and in general, you're always out there helping another Yid to make it a little bit easier for them, and especially now in today's days, I've seen that you go around being mechazik the communities in Israel, and we're going to be talking about it tonight to understand what's going on, what they're feeling, what we're feeling, how could we be mechazik ourselves. But tonight we're going to be discussing a little bit about mental health, burnout, and matzav in Eretz Yisrael. So thinking about all of the three things, to put it into a nutshell, It's really anytime a person finds himself in a place, sometimes could feel chaos, overwhelmed, and sometimes deep pain, and a number of emotions that are going on, and trying to figure it out, trying to get answers, trying to, to make sense out of it. Many people get stuck and they can't get out. They can't get out of bed. They can't continue life. And for all of us, most of us, it pulls us down, thinking about what's going on. And anytime we go through overwhelmed and a lot of different emotions, it could pull us down. So the first thing we need to know is that it's okay and it's normal, that we're human. And yeah, those emotions come up and it's okay. The question is how to deal with it. Those who can find a friend and discuss it, those who can go to a Rav, those who have to go to a therapist, which we'll be discussing tonight. Who from those is it enough that they just take some chizik and they can continue? Others, when they feel stuck and they need professional help, and they shouldn't find themselves in the wrong place. Hopefully tonight in Hashem, with the discussion with Dr. Freedman, we'll be able to clarify a little bit if it's okay to be by a Rav, a friend, somebody that's not licensed therapist, or who are those who need to be by a licensed therapist, and what's the difference, and maybe alternative medicine, and we'll discuss it in Hashem. So thank you very much for being with us tonight, and we're looking forward to Hashem.
Coach Menachem, for that beautiful opening, getting us into it. Okay, let's start off first. Tonight's share is Unveiling Wellness, a comprehensive talk on mental health, what to avoid in therapy, the enduring conflict in Israel, and strategies to combat burnout in today's fast-paced world. Oh, and I'm one of those. So we're going to get into it. We'll read your bio, Dr. Freedman, and then the floor is yours, okay? Dr. Jacob Freedman is a psychiatrist and a business consultant based in Israel. He's the author of Orphy Couch in Mishpacha magazine, as well as 2 other books from Menachem Publishing. While he's not with his patients, Dr. Freedman, also the new book, it's called Right What I Told My Patients. I think it just came out.
Yeah, the things I told my patients.
Right. And Dr. Freedman can be found learning in the Torah in the Old City or hiking the hills outside Yerushalayim. He can be most easily reached via his website, drjacobfriedman.com. Dr. Jacob Freedman, you're here. The floor is yours. Please open it up. And we have a lot of questions to get to.
Rav Usher, thanks so much for having me. And Coach Menachem, Mazel Tov on the gray in your beard. I remember when it happened to me, and all of a sudden people thought I knew what I was talking about. In the same sense, it was very clear that I would no longer play in the NBA. So, milas and chesronas on going gray, but with time, acceptance is the answer to all of my problems, and I hope that you'll make peace with it. Yimir Hashem. So what an amazing experience it is to be here. It's always a pleasure. Most importantly, I'm very grateful for you, everybody waking me up early. Early to bed, early to rise. I think Benjamin Franklin said that, and there's something to be said for it. So it's a pleasure to be here with everybody. And Mir Hashem, we can go ahead and share some good ideas on how to be our most effective out there. If we're going to start off with a bit of a schmooze, let's start off with the biggest thing, which is, what is it like to be here right now? I don't think you heard it because I was on mute, but there were a bunch of airplanes zooming over my house a few minutes ago, and it can be pretty intense being here in Eretz Yisrael right now. We should be honest, it's pretty intense being everywhere, but it can be pretty intense being here, Dafka in Eretz Yisrael. I think we have to realize that it's normal, as you said, Coach Menachem. It's very normal to feel a lot of very extreme emotions and to vacillate sometimes between them. It's okay to be scared right now. It's okay to be very sad right now when we think about the matzav. It's also okay to be angry when we think about the matzav. There's a lot to be frustrated with. And it's critical to know that these are normal emotions and that there's nothing wrong with again being heartbroken about all of these neshamas that have been taken from us and all of the terrible things that have happened to Klal Yisrael. It's okay to be very frightened wherever you are, because frankly, nowhere is safe right now, whether you're in Yerushalayim, you're in Melbourne, you're in Toronto, Miami, Berlin, wherever Jews are. It's a pretty intense time to be Jewish. And it's also okay, again, to be infuriated with the various governmental organizations that are supposed to be protecting us, infuriated with our enemies who have desecrated Hashem's holy name. We have a lot of intense emotions right now, and it's most important to recognize what one is feeling throughout the day. I spent a lot of time last week with my dear friend, Rabbi Dr. Benji Epstein Shlita, who's an incredible person. If you haven't had him on the show, definitely recommend it. He's one of the experts on mindfulness and meditation in our community. And one of the things we were talking about is how important it is to just be aware of what you're feeling. Most people kind of go throughout the day and they're not even aware of how nervous they are until they're jumping and shaking in their chair in the office, in kollel, at home, wherever it might be. Most people aren't aware of how angry they are until they're already yelling and screaming, and heaven forbid, even worse stuff. It's so important to be cognizant of the emotions and the feelings inside of us, especially during these intense times. So I think the question isn't, just what am I feeling, but it's what do I do with those feelings? Because we know that in tremendous times of distress as a nation, that these are our times of greatest growth. We know that Avram Avinu had his 10 trials, and it was only to have Hashem show him how great he could possibly be. We have these tests, these nisyonos, lehitnoseis, to show ourselves how great we can be. So it's an amazing time. I get accused of being a Chabad shaliach all the time because I have this crazy beard that I enjoy, and I have a nice walrus mustache. So people walk up to me on the streets and ask me for tefillin, which is a wild experience. So I started carrying tefillin and also a pushka in case people want to help me buy diras for my daughters. So that's a joke, Coach Menachem. You didn't appreciate that one? It's not bad. It's not bad. It's not great, but it's not bad. But Rav Asher appreciate it. Okay, good. Yeah, it's a good joke. Okay. It's an amazing time. You go walking around and you see people wearing tzitzis, and they're mamish, these brand new, beautiful snow white tzitzis. It's an amazing time to be here in Eretz Yisrael. It's tremendously inspiring. A friend of mine who lives in the Merkaz and works in a big office building in Tel Aviv pointed out that the giant billboard outside of his office on the side of one of the buildings has a fellow with all sorts of tattoos on his body, on his arms, on his neck, and he's wearing tefillin, and he has a kippah on, and he's saying Shema Yisrael. And on September 7th, a month before this current war began and this Tekufa and Klal Yisrael started, the billboard across from him was saying about the Haredi bloodsuckers and about the Messianic settlers destroying the modern Parisian state of Israel, and how beautiful it is to see that we're now getting along with each other and the dialogue is opening. And he said, isn't it so nice, Yaakov, that the dialogue is opening? We're talking with each other. And I said to him, Shlomi, you're being very Tel Avivi. I said, what we say in Yerushalayim is that Klal Yisrael is doing tshuva. It's a wonderful thing to watch. Tremendously inspirational. And I hope that everybody tuning in today has the opportunity to come to Eretz Yisrael as soon as possible. If not to stay, then to volunteer and just to go around and see what's happening in Klal Yisrael. The Achdus is mamish incredible. The best moment certainly was when I was having a cup of coffee with my dear friend and colleague Yossi Goldberstein, who runs Amudim here in Eretz Yisrael. And Yossi and I were having a cup of coffee and talking about what we could do to help the Klal. And we're sitting across from a tattoo parlor. L'tzareno Rabim, there's a few tattoo parlors downtown in Yerushalayim. Hopefully they'll be converted into Chabad soon, I guess, because apparently people think I'm Chabadnik. Or maybe Breslev. I've also been accused of that in the past. So we're sitting across from this tattoo parlor, having a cup of coffee, and a couple of guys come walking over. These guys look like ultimate fighters, okay? So, you know, tattooed up the wazoo, up their necks, wearing short sleeve t-shirts, and the muscles on these guys, you know, sometimes in the Frumvelt, we get nervous about taking CBD supplements and psychedelic drugs. By these guys, I was more nervous they were taking illegal steroids. I mean, their biceps were the size of my waist. And I haven't been eating as healthy as I need to eat. These guys were scary looking. Oh my goodness, were these fellows from the former Soviet Union, scary looking fellows. So they're coming along to open up the tattoo parlor in the morning. And as they're walking in, I see amongst all the tattoos and these, you know, Mr. Clean type haircuts, I see that these guys have pair of tzitzis on, both of them. And they're opening up the tattoo parlor wearing tzitzis. And I looked at my friend and I said to him, Yossi, this is it. You know, Klal Yisrael's doing tshuva. And we were so happy watching this. And I thought to myself, if I appreciated my tzitzis the way that these guys do today, woo, we'd have Mashiach by then. My goodness gracious, if we appreciated our mitzvahs the way that those guys appreciated their tzitzis mitzvah that morning, my goodness gracious. So it's an amazing time to be here in Eretz Yisrael. There's a lot of work to do. I ran around to about 30 or 40 yeshivas and seminaries, just trying to be mechazek people not to run home to the States. And a lot of people have stayed here and a lot of people have grown tremendously. A lot of people have shown up here and are really doing fantastic things. And a lot of people are coming. You know, I know that Mrs. Ruchama Klapman of Mask is leading a trip here right now of therapists that are coming to volunteer. I'm actually speaking with them in about 4 hours now, if I'm still awake, in Yirtz Hashem. And wonderful, wonderful things are happening with Klal Yisrael. So it's an amazing time to be alive. And we should appreciate that as a people. So I'm sorry for making fun of your beard. I'm actually just pointing out that it's great because hopefully people will start to think that you are above the age of 25, Coach Menachem. And then maybe they'll listen to you.
That's why I shaved, Dr. Freedman, you know? It's completely white.
I hear.
Let's jump into the polls, and then we're going to get into questions. Thank you for that opening. Here we go. They asked the Olam 3 questions. Everybody answered to the best of your ability, and then we're going to jump into all these questions in depth. Which methods of therapy have you utilized in the past? 4 options. Licensed therapist, acupuncture, alternative natural methods. I did that twice. Every time it keeps coming up twice. Okay, and people speaking to very smart people who understand. So basically a licensed therapist, acupuncture, all these other type of alternative types of methods, or speaking to very smart people who understand, like somebody that really gets it. Second question, in your opinion, what defines burnout? What do you think when we talk about people are burnt out or you just burnt out? What does that mean? A, same as depression, can't continue with life. B, lethargic, not motivated, just C, burnt out only in one area of life. That means the way you categorize burnt out, I'm burnt out of working, I'm burnt out of this. Or D, there's no such a thing, just needs chizik, you're just a little bit out of it, you need a little boost. Third question. Where do you think this war in Israel is headed? 4 options. Years of fighting and a lot of people dying. Seems like it's going to be coming to an end shortly. I think the war will lead into many other wars around the world. Or D, this is the beginning of the coming of Mashiach. So those are the 3 questions. It's really one in every era of the topics we're talking tonight. And we want to see what everybody feels. Okay, 3 more seconds, and then we're going to share the results, and then we're going to talk about it. And again, anybody wants to ask a live question, please text. It's Ryan. And there's a lot of questions that came in we want to cover, and our time is short, right? And there's a lot of work to cover. Here we go. First question, which methods of therapy have you utilized in the past? A whopping 65% say they go to licensed therapists. 4% of people only believe in the acupuncture alternative natural methods. And 30% of people speak to very smart people who understand. That's the first question. Dr. Freedman, any comment on this?
Yeah, I think that these are all options, and Emir Hashem, we can talk about the milas and the chesronas of each of them.
Okay, second question, what defines burnout? 11% of people think it's the same thing as depression, can't continue with life. 58% of people feel it's like not motivated, very lethargic. 24% of people feel burnout is only one area of a person's life. And 7% of people feel there's no such a thing, they just need chizuk. Okay?
Yeah. That I can say is also true. All of these are aspects of burnout in some ways. If we really want to, go there right now, we can define burnout, which is, the combination of exhaustion, meaning feeling physically crummy, tired, inability to focus, some of those same symptoms that we see with depression, a cynicism, a negative view of the world that one is involved in, a negative view of oneself in that situation, and a negative view of the future within one's work situation or school or
how would you
yeshiva
define in short the
situation.
difference between burnout and depression?
Yeah, so burnout is circumscribed to one's situation. We might call it a situational depression. So somebody who has a job that they hate, working in an Amazon warehouse, and yet when Sukkot comes and now they're going on a Holomoid trip to Six Flags is doing fantastic, we would call that burnout, because it's limited to a certain situation, whereas a clinical depression, a person is depressed at yeshiva, depressed at work, depressed at home, depressed on vacation. In burnout, a person is unable to function in yeshiva, but functions fantastic once they leave and get a job. Unable to function in the workplace, but when they go on vacation with their family, they're in the zone.
Would it be fair to say that situational depression and burnout is basically the same word?
I think that sometimes they can be used interchangeably, and there's a value to that. But burnout is a real syndrome, and depending on what situation people are in, for example, there are studies that show that well over half of physicians feel burnout over the course of a year. And it's something that we really have to address because, as I said before, the physical exhaustion, the psychological cynicism is also associated with a lack of efficacy in the workplace in one's life. And so when people are burned out, specifically healthcare workers, patients do poorly, unfortunately. When Rebbes are burned out, kids end up getting terrible chinuch in the classroom and potentially getting cursed at or whacked. And when yeshiva bochurim are burned out, they end up flying to Cyprus and needing lawyers. And Ben Brafman Shlita is expensive these days.
He gives a discount if you say Coach Menachem. He was on our program.
I
Okay,
know.
third question. This is for you, Dr. Freedman, since you're a Navi. Okay, where do you think this war in Israel is headed? 8%.
Ay, 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 ay.
Years of fighting and a lot of people dying, 8%. Seems like it's going to come to an end shortly, only 10%. 29% of people feel, I think this war will lead to many other wars around the world. And a whopping 53% feel this is the beginning of the coming of Mashiach. What is Dr. Freedman's Nevius?
Well, forgive me for being an uber rationalist, but I think that the situation is both very frightening and it's very inspiring. I had a discussion with Rav Asher Weiss Shlita a couple of months ago, and one of the things that he pointed out is that people are normally averse to taking sides and describing, I'm for or against. People like to play the middle ground. However, this has been a opportunity for many people to say, no, I don't like the way that the world is going. For Jews and for Goyim alike, this has been an opportunity for people to pick a side and to side against barbarism and to side with morality. So that's a very exciting thing. Does that mean that Mashiach is coming? Well, again, I'm not such a big mikubal these days, or if I am, I'm hidden. But I can say that we have to imagine we're headed in the right direction because there's a lot more achdus in Klal Yisrael, and I think people are a lot more open to respecting each other within Klal Yisrael, and that's got to be a part of anything positive in a spiritual sense.
Okay, let's jump into the questions. We have a lot of questions, a few live already. I'll start with the first question because I want to cover this, and then we'll get into a lot more questions. Number one, I've been dealing with depression for some time, and I've been seeking help from a healer who's not a licensed therapist. She uses various methods, and I've seen some improvement. I was wondering if there might be an issue and if I should consider stopping these sessions. Let's just broaden the question. It could be natural, it could be acupuncture, it could be psychedelics, it could be breathing, and the person is suffering from depression. They're going to these alternative things to get help. As we know in the communities, all these things are very powerful right now. Breathing techniques, nobody could say bad about it. It's just breathing. The psychedelics, there's a whole topic right there. And then just in general, alternative healing. Like, what's your opinion if somebody really is going through, let's use it, clinical depression, and they're going to alternate methods to try to help it, and they are feeling better from it temporarily? What's your opinion on this?
Okay, these are great questions. First, I do want to say that for whoever asked this question, I'm sorry you're having a tough time. You should know that you're not alone. At least 20% of folks will experience depression at some point in their life. That means that if you live in a building in Har Nof that has 30 families, again, that you are one of 6 women who will experience depression at some point. If you live on a cul-de-sac in Lakewood that has 20 families, again, you'll be one of 4 abbas, 4 tatis on that street that will experience depression at some point. So the most important thing to know is that you're not alone and you shouldn't be embarrassed, because when people are embarrassed about struggling with mental health, it in and of itself is a big barrier to getting the care that one needs. And I believe that that's a big part of why
I want to
people...
interrupt you, Dr. Freeman. If I remember correctly, if my memory jogs me correctly, the first time you came on, one of the big topics we were talking about not being ashamed of going for help. I think that was one of the topics we actually discussed. I think we came a long way since then over the past period of time, no?
I agree. And I think you can practically see that in terms of the number of phone calls that our colleagues, Rabbi Babad, Rabbi Orenstein here in Eretz Yisrael, Rav Shlomo Katz, the number of phone calls that people get for relief. The number of people reaching out for professional help has increased. There's an organization we know in Lakewood called Confe Fega, run by Mrs. Rosenfeld.
Yeah, we did that at once here also. Yeah.
The number of phone calls and people that are referred to that organization that provides support for families in the community has skyrocketed. So I see that as a positive thing. Not that more people are struggling, but rather that more people are open to addressing these struggles. So I think that those are simply facts in our communities. You know, burnout is not treated by psychiatry. Burnout is treated by working on one's lifestyle and finding a better work-life balance and exercising, sleeping better, eating healthier, avoiding alcohol and recreational drugs, and just working on positive coping strategies. It may or may not include proper therapy, but there's a big difference between burnout and major depression, which needs to be addressed by proper therapy and by proper psychiatric care. So one of the first questions that I would ask when somebody says they're depressed and they want to go to a healer, to a psychiatrist, to try psychedelic drugs with the hard money guys down in Ecuador, whatever is going on in one's life, the question is, what is this? So that's really a question for a professional. And part of the training as a social worker, a psychologist, a psychiatrist is really parsing out the differences between feeling frustrated, feeling sad, feeling upset, feeling burned out, and between psychiatric illness. We shouldn't forget that the majority of people who have schizophrenia will first show up to their primary care doctor and say, I'm feeling depressed. I'm feeling like I can't focus. I'm feeling like I'm nervous. So that should not be anybody's problem, but it's 1% of the population's problem. We should keep in mind that approximately 2.5 to 3% of people have bipolar disorder. And those folks are at tremendous risk of bad outcomes unless they get proper psychiatric care. And that begins with a diagnosis. Similar to when somebody has a problem in their bathroom and there's a clog, you can go ahead and try and stuff your arm down whichever pipe and see what you find, or you can call a neighbor who maybe is a bit handier than you are. I know I have plenty living here in Eretz Yisrael because I am a chutznik and therefore not handy and surrounded by so many wonderful people whose name I still can't pronounce, who can definitely help me out. But you can bring that person to your house and hopefully he can fix your clogged drain, or you can call a professional. And that doesn't mean that you have to follow everything the professional says, but it's always worthwhile to call a professional, because if your pipes get busted up, you're going to end up paying thousands of dollars and being very unhappy. Wouldn't it be nice to go ahead and have a professional involved at least once in the beginning? So do I have a problem with healers? Do I have a problem with vitamin givers? Do I have a problem with acupuncturists? Do I have a problem with color therapists and Bach flower ladies? Not personally. I think it's actually really special. Klal Yisrael wants to help. Specifically within our community, the people who do this stuff are very, very well-intentioned people, I would imagine, in the vast majority of cases. I don't even think that you have to work hard to be dan l'chavschus. People really believe in this stuff and they want to help. And that's a very noble thing. And, you know, Mik'amcha Yisrael, you know, Klal Yisrael wants to help. I think in the same sense, we have to be wary, because while certainly everybody benefits from tapping, that's the placebo effect. And that means that, trach good, design good. And there's no proper evidence that suggests that the vast majority of these treatments provide any success in terms of the resolution of symptoms for people who are struggling with mental illness. Now, again, they can be helpful for people that are stressed out, people that are
Dr. Freeman, I'm
unhappy.
sorry, tell me if I'm wrong. I'm sorry to correct you, but I think that psychedelics, if you're dealing with a severe mental health issue like bipolar schizophrenia, could actually cause damage.
Yeah, so psychedelics is a whole other topic. I'll get there just in one sec. I'm not here to make a pasak on whether or not acupuncture is us or any of those other things. Rev. Elyashiv Zatzal said that Chinese medicine is us, or that also includes Ayurvedic medicine and all sorts of other things. That some nice guy from Queens who went off the derech and went to India for a decade. I wouldn't trust him to fix my drain. I definitely wouldn't trust him to fix my brain. I think that, again, because there's so much stigma associated, both in our community and in our own heads, with going to a psychiatrist or a psychologist or a social worker, that sometimes we run for other solutions. And we should just be wary of that. Again, being healthy is a wonderful thing. Exercising is a good thing. Learning how to breathe deeply decreases blood pressure, decreases stress. These are things that work. But once a person has entered into a place of mental illness and is struggling, it's so important to get the proper help. It's not just important for the patient themselves, but people who are depressed, people who are anxious, people who have serious mental illness and are really struggling, it also has a burden on their spouse and on their children. And so many divorces could be prevented. So many kids going off the derech could be prevented if mom and dad had gotten the help that they need for mental illness or for substance use. Now, you brought up psychedelics, and we should address this. This is a whole Ganser story that we should be very thoughtful about. I should say that if you asked me 5 years ago, or even 3 years ago, my thoughts on psychedelic treatments, whether that's psilocybin, psychedelic mushrooms, LSD, MDMA therapy, ketamine, whatever it might be. If you had asked me 3 years ago, I would have said no, 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 and no, no question. Now, when you ask me about it, my response is no, 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 but this is exciting. And I believe that at some point soon, these will be really powerful tools for helping people in the correct setting. Psychedelic medicines are some of the most powerful treatments out there. These are tremendously effective in changing the way that people think. These are so much more powerful than many of the drugs that I regularly prescribe as a psychiatrist. That's why you have to be so careful with taking them. Oh my goodness gracious, people who have genes for serious mental illness, which are the most impulsive people out there that like to just try psychedelics with some fun guy who's a Karlbacher to the nth degree. You have to be so careful with this stuff. My goodness gracious. Is there tremendous medical potential for psychedelic treatments in trauma, in addiction, in depression, in OCD, in anorexia? Absolutely. There's tremendous potential, and it's so exciting. That being said, there's tremendous risk. As a community, we only hear the positives. Nobody goes ahead and shares that they were admitted to a psych hospital. Nobody goes and shares that they jumped off of a cliff and broke their leg, like happens every single year in Telstone. Nobody goes ahead and talks anymore about the Swedish guy that took psychedelic drugs 2 years ago, went home and stabbed his son to death 14 times and was hospitalized for weeks until he woke up and realized what he's done. He was acquitted of murder because he was in a totally delusional state. And the person who gave him those drugs, I believe, is sitting in jail for a long time. Again, I had no connection to that specific case, but this is public knowledge. Psychedelics are very, very powerful. And again, I think we know people who report that they have changed their lives. We also know people, as you said, Rav Usher, though, who it could ruin their lives. And people who have the genes for serious mental illness, again, who are the people who are hurting the most, and the people who are the most impulsive, and the people who are most at risk for looking for any solution that could work to change their lives. When they take these medicines, it can cause acute psychotic episodes, which is a tragic thing. We also have to be careful in the studies. These medications are taken in a very regulated, calming environment. They're also given specific doses of purified compounds. We know plenty of people that are given cheaper knockoff versions or the wrong dose and end up having terrible psychological experiences, in addition to having medical problems. MDMA can kill people. Ecstasy can kill people through serotonin syndrome. LSD can mess around with the cardiovascular system. These are not the safest things. Ketamine is a horse tranquilizer. It's a dissociative anesthetic. Now, again, when used in a ketamine clinic and prescribed by a psychiatrist, it can be a very helpful treatment for treatment-resistant depression, OCD, and other situations. I have a colleague, Dr. Stuart Seidman, who's a fantastic psychiatrist that's done great work opening up a ketamine center here in Eretz Yisrael. Dr. Strauss and the clinic at Mayne Yeshua have done wonderful things with ketamine treatments. But this is amongst the most dangerous psychiatric treatments out there. And for patients who are nervous about taking Prozac, which has been around for longer than you and I, Rev Usher, and is safe during pregnancy for the developing fetus, and they say, whoa, I'm not taking any psych meds, psychedelic mushrooms, they grow naturally. Yeah, on cow patties in Wyoming. That's correct. So now you're going to eat that and end up in a psych hospital. Oy boy. Okay, that's a quick, not rant and rave, but just thoughts about this stuff. You know, I believe that compounds from these psychedelic drugs will be synthesized. We will get treatment protocols, find the correct doses, and in Yirtzeh Hashem be able to help a lot of people. And I think it's coming soon, but we have to be so careful with this. We have to be so careful with this. And we have to be careful of anybody who promises an immediate solution is the other thing. Anybody who guarantees you that you're going to be feeling better immediately is selling you snake oil. I'd be wary of those folks.
Dr. Freedman was just saying that we had a few sherm on psychedelics, and one of the big doctors who actually has a ketamine clinic, he says that the face of medicine in 10 years, you know, once these things are developed properly and they're going to be able to know how to use them properly with the right dosage, could really be a life changer, especially to people that have mental illness. They're really hoping that people that suffer from severe mental illnesses and depressions and bipolar, that there's a hope that these medications will be the medication that will actually cure them versus pushing the ball down the road with all these other, you know, cocktails. Just want to mention that.
Yeah, well, I agree. I do share optimism that we're going to know so much more about this and that these treatments will be infinitely more effective. And the main thing, though, to think about is that right now, people who are taking these treatments on various retreats that are marketed to our community. This is not done in a safe setting, in a regulated setting, and the dosing of these very powerful chemicals, there's a very small therapeutic window. You know, think about the amount of whiskey that a person can drink and not be drunk, be peacefully buzzed, and then be totally out of control. The therapeutic window of psychedelics is infinitely smaller in terms of micrograms as opposed to shot glasses. So we have to just be so wary here.
Okay, Dr. Freedman, we have a lot of questions. Let's get to it. Okay, Sarah, you're on first.
Hi, I'm really honored. Hi, Dr. Freeman. I feel like I'm talking to a celebrity here. I think you answered a lot of my questions earlier. We talk about, certain strategies for trying to deal with depression, but I find it does go hand, at least with my situation, where it might go hand in hand with lethargy. People feel lethargy is something different, just slow, low energy, low motivation. We all go through the doldrums, but I find that it's how to fight the spiraling. It could like spiral into depression because there's a feeling of helplessness. Like, hey, I'm in a rut. What do I do? And then what can I do? I have no. Maybe I don't have the skills. I don't have the, not what they want on the outside. You know what I'm saying? You want to make changes, or you don't really know how, where to begin. So I find that the lethargy, I don't think it's necessarily, it's sort of a chicken or the egg question. You're depressed because you're lethargic, or you're lethargic because the depression just, leads to, like, on top of that, I may get, distractions. We all, we have our day-to-day curveballs, the things go wrong,
I think
so.
that you're bringing up some great points, Mrs. Cantor, and it's very brave of you to address this in this forum. And one of the main things that I can answer for you without knowing anything about your particular case is that a lack of energy is one of the core symptoms for many people in depression. Difficulties staying focused and organized can be a core symptom for some people. And
ADHD,
in the same sense, that worsens the depression because it makes it difficult to follow up with one's treatment plan, and it makes it quite challenging to do a lot of the healthy things that can help to treat depression that don't require a physician. So one of the things that I'm very excited and passionate about, both in my own life and for my patients, is the importance of regular cardiovascular exercise. Cardiovascular exercise, for many people, is a dirty word, or two dirty words together, or three dirty words together if we count cardiovascular as two words. But when a person exercises every day, paradoxically, it actually gives them more energy. When a person exercises throughout the day, it puts stress on the body in the moment, but it decreases stress throughout the day. And I think for folks who are above the age of about 20, it's a good thing to discuss with their physician how much cardiovascular exercise their body can handle. But ideally, people who are doing 30 to 45 minutes of cardio a day, it's a fantastic treatment of depression. And it really helps the body to feel better. It improves sleep, it improves energy, it improves focus. I can't tell you how many young yeshiva bachurim who don't want to take stimulant medications for their focus issues have been tremendously successful by just waking up earlier, exercising before shiur starts, and then being able to fall asleep earlier at night. And the combination of getting enough sleep and getting enough cardio in the morning has allowed them to be much more effective human beings.
It was like
So
mental clarity, in other words. It's just a way of
for,
gaining the,
for sure.
yeah,
So,
yeah.
there are studies that suggest
Mhm,
that in certain cases of mild to moderate depression, that
mhm,
cardiovascular exercise on a daily basis
mhm,
is as effective
mhm,
as treatment with an SSRI antidepressant.
mhm.
And frankly, there's really no side effects of cardiovascular exercise beyond smelling like a schwitzy bocher, and that can be fixed in and of itself with a shower,
Thank you.
which is something I try to do at least once a week.
Thank you. Okay.
Hatzlacha.
Thank you.
Okay, let's go to the next live question. Amir?
Hi,
Hi, how are you?
Good, Brooksham. Thanks for doing this.
No problem.
I'm going to kind of change the topic a little bit. I mean, it's still, couched around, burnout and good mental health in the area of shidduchim, and specifically shidduchim in the 40s. So basically, people who have already gone through a lot, divorce or widowed. Um, is there any kind of like pointers or advisement you could give on shidduchim in the 40s and plus? Going forward, keeping a positive and healthy mindset and outlook.
That's a great question. In terms of how can I avoid burnout? So I think that to answer that question again, generally, the healthier that one is, and the more that one takes breaks and is able to focus on their core beliefs, as opposed to getting distracted with various mishigas, the more effective one can be when they're starting to feel burned out. Keeping a journal is a really good way of tracking one's mood and tracking one's goals, tracking what's working and what's not. Shidduchim in the 40s. I once heard that Belzer Rav told a friend of mine that Belzer Rav Shlita had had every nisayon in the world except for being an altar bacher, which seems to suggest that being an altar bacher is quite a difficult thing to go through. So I would recognize that this is a challenge, but that it's a challenge that uh, I'm sure you can be successful with. And I would keep in mind that, for every man or woman who's experiencing this, there's certainly somebody else who's also experiencing the same thing. I do encourage people in general, irrespective of their age, irrespective of the issues they're going through, to be more open-minded when it comes to shidduchim. I think that a lot of people have a very specific thing they're looking for, and as a result of that, they leave other things out. I'm a big fan, again, of encouraging people not to be judgmental in shidduchim in the same way that they would hope somebody else wouldn't judge them for whatever they might view as a chesron, and would rather try to look at the whole picture. I encourage folks to really be a lot more open-minded. Practically in my field, I'll just throw out a thought. I think that a lot of my patients are nervous about shidduchim if they're taking a medicine or if they have a diagnosis. And what I always tell them is, if you work through this, you'll be a person who is stronger and knows a lot more about themselves. I actually have many patients who have been through the therapeutic process and are infinitely healthier people than somebody who hasn't been, than their roommate who never went to therapy, never took a medication. So I really will tell the families of young men and women who call me, obviously with my patient's permission, to say, I hear you're treating Yossi, for anxiety. Does that mean he's crazy? Can he be a good husband? And what I'll say to them is, Yossi is great. He knows exactly what he needs to work on. He knows exactly where he's come from, and he knows exactly where he's going. Compare him to Ruvain or Shimon, who's never done this work. I can't give any ADIS on them. I can give you plenty of ADIS though on Yossi. We know exactly what's going on with him. We have no idea what's going on with anybody else.
Is that the first step? Is that the first step you would tell somebody in Shidduchim they should call his therapist?
Okay. I don't know if it's the first step, but anytime somebody is in therapy or is seeing a doctor, and one is in shidduchim in the standard shidduch process in our community, I think it's a very reasonable thing to have a conversation. I would say at least once every other week. A former patient of mine says, Baruch Hashem, I'm dating, things are going well. And I want you to speak with Mr. Green and Mrs. Green. And I'll say, great, they can book an appointment, come on in. I always tell my patients that I have to have seen them within a few months prior, because it could be that I haven't seen somebody in a year and I don't know what they're up to. I don't know where their symptoms are at. But if I hear that my patients are doing good and they're stable, and I feel as though they're in a comfortable, solid place, then I'm happy to share my thoughts with the young woman's family or the young man's family. I think it's very important. And this is something that really good professionals in our community should have learned as part of their shimush in our community, not as part just of their licensing, which allows them to describe diagnosis and treatment and prognosis, but really as part of when you work in the Frum Welt, you have a better understanding of the Frum Welt. And this is called cultural competency. So whereas being a good professional and having good academic skills in the treatment of mental health is very important, so is having a cultural competency, meaning understanding what's happening in our community. I'm actually speaking right now with the Swedish community in Antwerp about doing a trip out there to train the Goyische psychiatrists in their city about what mental health looks like in our community and what are the expectations in our community for what a psychiatrist can and cannot do, for what a therapist can and cannot do. So that way they can provide a service which is culturally competent, meaning understands what our community is going through. And frankly, the academic hospitals in that city are thrilled with the idea of having somebody come and teach them. So this is a really important thing that we have to keep in mind, that when one is looking for, just a tangential thought, but a big klal, when one is looking for a therapist, when one is looking for a doctor, they really have to find somebody who's not only a mumche, but is also a mumche taka in the community. And we know that there's the Ganser community, and then there's also specific communities. And that's a big role where family members, rebbes, askanim can really add a lot by explaining the specific context. I'll never forget when I had a woman come to my office telling me her husband had OCD because of the length of her shadel. And I didn't know if her shadel was too big or too small for their community because I wasn't 100% sure which Hasidic she was from. So I had to actually call a dayan in the community and say, exactly how long is a shadel supposed to be when it's too big or too long? Because apparently some guy is either bothering his wife or has a legitimate concern. Anyways.
Okay, Reverend Freeman, we have so many live questions. Are you ready?
Do it.
Do it. Here we go. Unmute.
Hi.
Hi.
Okay, so I have a sister who is suicidal and she's been in and out of the psych ward, and I have this feeling in me where like I have to be her savior, but in reality I don't really need to be because she's in therapy and psychiatry. But at the same time, I guess because I'm her sister, so it's like natural. I like make myself crazy to be her savior. Meanwhile, like I really don't have to. So I want to know like if there's any advice you can give me on how to like make myself like away from the situation, but also care about her.
Refuah Shalema to your sister, first off.
Thank you.
I am a big fan of the Hasidus of Alcoholics Anonymous and 12-step programming. And it's not a cult. Rabbi Tversky Zatzal taught us about that and wrote Teshuvah Through Recovery, amongst many other fantastic books, where he really expounds on the beautiful Hasidus of the 12-step program. And one of the things that family members can do when they have a spouse, a sibling, a parent, a child who's struggling with addiction is to go to Al-Anon meetings and to really learn about not being an enabler, and to really learn about what they can do to be a more effective family member to ensure that their loved one gets the help they need. So one of the main things that's taught to family members who have loved ones struggling with substance use and addiction is you didn't cause this, you can't cure it, and unfortunately, you can't even control it. The only thing you can do is to control yourself to make sure that you don't make it worse. Now, this is something that can be learned through family therapy. I know that there's a lot of great family therapists out there that work with complex cases of this nature, but I think that there's also good support resources in our community. I know that Amudim and Relief and Chazkenu offer support for women in our community that have family members who are struggling. OHEL, other good organizations, offer these supports. In Israel, there's Enosh, Mila, Ezer Mitzion that has support groups for loved ones, for folks who have loved ones that are struggling with chronic mental illness. In Eretz Yisrael, there's an organization called, I believe, the National Association of Borderline Personality Disorder, and this provides a lot of training and support for people that are struggling with loved ones who are chronically suicidal. And here in Eretz Yisrael, there's a great clinic called Machon Devir, MACHONDVIR.org, that's run by a colleague of mine named Dr. Shmuel Harris. And he's kind of the dean of addressing these issues with families.
Right. So here's the thing, like I'm not worried about her because at the same time, like she is in therapy and she goes to a psychiatrist and like everyone's on top. Yeah, Baruch Hashem, but she's like looking at like she's looked after, but for me as a sister, like it's just so hard like to constantly not think about her and make myself crazy about it.
Yeah, I hear that. It might be that there is a role for you attending support groups to hear what's working for other people, or to think about seeking out an experienced family therapist to guide you through this process. Because, again, sometimes the stress of having a loved one who's struggling can bring out the worst in us. Hang in there.
Thank you.
Okay, let's go to the next live question. You're on. Unmute, please. Hi.
Hi, Dr. Freedman. I had a question. Unfortunately, we lost a close family member after multi-year struggle with mental illness, RTC, psychiatric hospitalizations. And the one common thing we felt, or I felt, but most of the family felt, was that, the stigma around therapy has been removed a lot in our community, or at least is getting better. But the stigma around mental illness, and I'm not talking about psychosis, I'm talking about, people who seem regular but have, major depressive disorder, eating disorders, general anxiety disorder, social anxiety disorder, all those type of things, emotional dysregulation involving in, self-harm, and it's like we always felt on the defensive, that we have to answer, if someone is sick with cancer, there's never questions of, is she this, and how can we as a community get better, specifically in removing the stigma about mental illness, true mental illness, again, not just, schizophrenia. It's like people have the belief in the community that if you have schizophrenia, psychosis, okay, he's crazy, quote unquote. But mental illness or major depressive, just like you could die from cancer, you could die from depression or from suicide, which is someone who's suicidal. So I just wanted your take on that, really feeding off your first point about going to a psychiatrist. So people who we did go the regular route, but someone who's really sick could still die from that.
Absolutely. I'm sorry for your loss is the first thing to say, and I'm sorry for Klal Yisrael's loss. It's terrible when this stuff happens. I'd like to say a big yasher koach to Coach Menachem and to Rav Usher for providing a platform for our community to discuss many of these issues, along with so many other great organizations and great people out there that are really talking about this stuff. I think that when our leadership raises this issue, it's a good thing. The Aguda has a mental health conference around Thanksgiving every year. That's a very positive thing. That's a newer thing. When Mishpacha magazine let me write a weekly column about mental health and the treatment of people in our community, this allowed people to start talking. And then when I got too busy, it was replaced by ads to go to Dubai. Can't fix
Dr.
everything.
Freedman, let's be honest, they're both therapeutic.
If you're in the Israeli Arab mafia, Dubai is a great place to go. I think that when brave people in our community share their experience and are willing to break the fourth wall and to really talk about their personal struggles, that is a tremendously powerful thing. There's a fellow in Beit Shemesh who wrote a book about his struggles with depression and even suicidal thoughts, and it was published by Mosaica. Rabbi Haber put it out. I believe his name is Yoni Palmer. And it's a tremendously brave thing that he did, talking about his personal experience. And I think it gives voice and perspective to people who are struggling in our community. I remember when Rabbi Wallerstein Zatzal talked about having suffered abuse and been the victim of abuse. And talking about that is a very brave thing. And that gave a lot of koach to people who had had a similar experience. I have a friend who is a Rosh Yeshiva, a very beloved person to me, that has openly spoken with Bacharim at his yeshiva about his experience as an addict. Baruch Hashem, he's been sober for close to 20 years. But he had serious substance abuse problems at one point in his life. And the courage to say that as a Rosh Yeshiva, the courage to express this, has really made his program one of the most rapidly growing yeshivas in Yerushalayim. So when people talk about their personal struggles and share this, I think it really, oh man, it's brave. You got to be courageous to do that. Given the stigma and shidduchim and this and that and everything else. But it's a wonderful thing when people are able to do that, and it's very inspirational. So my hope is that more brave people will be open to talking about their challenges. I think we have time for a few more minutes before I got to run to Shul. Forgive me. And Rav Usher, I want to know what moisturizer do you use? Because in case I decide to shave and want that baby face once again, I want to be ahead of the game and know what to order on Amazon after the blockade allows products to arrive here.
I'll tell my wife to be in contact with you, and she'll let you know.
Yeah.
Okay, let's go to the next live question. We have to Chapa Ryan. Let's go. You're on.
Hi, first of all, thank you very much for all your articles, Mishpach. I always really enjoyed reading them. I wanted to ask, I work at a job, Hashem, 9 to 6, my remote pretty much, and work myself. How do I avoid burning out? How do I, keep myself in a healthy place before we have to work on fixing the problems?
Great. So that's a wonderful question. I know that you are most likely not Bracha Weiss. However, Rabbi Taub will be speaking on What is a Woman next week. So if you are Bracha Weiss, we'll have a lot more clarity within a week.
If he is Bracha Weiss, you should definitely come back next week.
The most important thing is insights, as always. We can't have a solution unless we have a problem. We don't have a problem unless we're sitting down and trying to figure things out. So most of the time when a person is asking themselves, do they have a problem? It's great to ask other people around. Go for the collateral information. Ask your coworkers, ask your chavrusa, ask your spouse, ask other people in your life, do you think that I'm burned out right now? Try and get some objective information. As far as the treatment of burnout, it's important to change the environment. Sometimes that can be done in a big way by switching a job. Other times it can be done in a small way. So if you're working remotely and you're sitting in your basement doing that work, try to go to an office and take a shared office space at a WeWork type place where maybe you could be surrounded by some colleagues throughout the day. Try and work 1 day a week in the basement, 1 day a week at your accountant's office. Try and work 1 day a week at the bagel store in order to mix things up. Having some social support, connection with colleagues, especially if it's remote, try and get together, even in a social setting. Go to play mini golf. Relaxation strategies, mindfulness. Let me put in another plug that you got to get Dr. Benji Epstein on here to talk about mindfulness. He is so good at what he does, and he's a very dynamic speaker. But meditation, relaxation strategies, even for a few minutes a day, are really helpful for decreasing stress, finding perspective. Exercise, we know that cardio is really important. We know that sleep is really important. Most people don't get the sleep that they need. You really got to get closer to 7 to 8 hours for most people. Some people even need 8.5 or 9 hours. That's just the way their body is built. It is absolutely critical to take care of your body. And then also to understand there might be some things at work that you enjoy doing and some things that you don't. And if there's a way for you to do more of the stuff that you enjoy and less of the stuff that you don't, whether by outsourcing or trying to come to a solution with your employer, there's nothing wrong with trying to be as effective as possible in that manner. I'm going to run to Shul now. I'm tremendously grateful for having been here with everybody. What can I say? Claudia
Dr. Freedman, we're going to jump straight to the closing. First of all, thank you for coming and giving your time. We love when you come on. And I know it's hard with the time. Hopefully one time you'll be in America and we could do it the full.
Hopefully soon you'll be here. I'm out of the closet as it's Sioni. What is it, Sioni?
Yerushalayim.
And leave us with a good closing for it. Menachem, we'll see everybody next week with Rabbi Shei's Tab. It's going to be an amazing share. We're talking about what a woman's role is today in Klal Yisrael and their stressors and what they deal with. And it's something that we did it on the men's version and it was super powerful. Hopefully next week will be amazing. Please join us. And Dr. Freedman, leave us with some closing words So Olam can take back with them to give them chizik, and then go pray shacharit.
Hashem loves all of us so much. You don't have to be accused of being a Chabadnik or a Breslover to know that. We know that all of the challenges that we get are just to make us stronger. I was learning the Nesivo Shalom on Shabbos, doing that this year, Bli Neder. And he brings that Rav Arla Karliner, Rav Arna Gadol of Karlin, said that it was easy helping people to do tshuva because he felt like a realtor, like a mitavech. These people want to sell, those people want to buy. It's an easy shidduch, putting people together with the Kadosh Baruch Hu. So we have these tests, we have these challenges, but Hashem wants us and we want Hashem. And sometimes we involve other people in our stories, and we should be grateful to have the experience and the opportunity to meet professionals who can help us, as well as good, loving, smart people that are willing to listen to us. Like the survey said, those people are wonderful, whether they're rebbes, spouses, uncles and aunts, parents and grandparents, or neighbors and mentors. We should all be zoche to help each other in Yirtz Hashem, whether as professionals or just good neighbors. So Yirtz Hashem, we'll get to talk again at some point soon, and I'm grateful. And Usher, if you could again have your wife be in touch with mine regarding the moisturizing lotion of choice.
Dr. Freeman, all the programs I've seen you on and all the articles you've written, by far, you were the funniest tonight, by far.
I just need to get rid of these forehead wrinkles. Sei gesund.
Take care, everybody. Have a great night. See you next week.
Thanks, everybody.
Have a great night. Thank you, Dr. Freeman.